number 2 on how we will allocate funding for SUNY Downstate Hospital. We are excited to have you here this evening. My name is Oma Holloway. I'm the founder and chief strategist for Adina Consulting Group, and I have the pleasure of serving as your moderator this evening. We had our first public hearing was held at SUNY Downstate on June 22nd. We had a full house. Over 50 testimonies were given, and we had over 30 written testimonies submitted. So we are very excited for public hearing number 2. I want to make sure that I assume there are more people coming in, but we want to get started in respect of everyone's time. Before we get started, I feel that it's most important that we start off this evening in prayer. So I'm going to ask Dr. Straker Pastor Straker, if he could lead us in prayer. You can do it from your, or if you would like to come here, why don't you come here?
Good evening, everyone. Let's all stand as we pray. Our Father and our God, we are truly grateful for this day that you have given to us. We rejoice, we're glad in it. We're grateful, God, for traveling mercies that has brought us from near and far to come together this evening. We thank you, God, for Downstate and all that it means to us. We thank you for the doctors, the nurses, the faculty at the university. We pray, God, as we speak tonight, we pray, God, that your wisdom will prevail in this room. We pray that our speech will be seasoned with your grace. We pray that our board will be able to have an ear to hear what the people in the community is saying. Most of all, God, give us the ability to hear your voice as we continue to do what is right for your institution where you use your power of healing and grace. So God, be with us tonight. Let your peace be amongst us. And we thank you that we will have great success. I pray this with respect to all faith traditions, and I pray this in the name of my Lord and Savior, Jesus Christ. Amen.
Thank you, Pastor. We are very excited and honored to host this public hearing here at Medgar Evers College. This is truly an honor. And we also are excited to have the voices of Community Board 9 also present. So before we introduce our distinguished Downstate Community Advisory Board, I would like to invite Dr. Pat Ramsey, President of Medgar Evers College, to bring greetings to all of you.
To Chancellor King, the panel, and to all of the community members assembled, it gives me great pleasure to welcome you to Medgar Evers College. The college birthed out of the Central Brooklyn community with social justice in its DNA, named for Medgar Wiley Evers, who gave his life for the rights of people in Mississippi to vote. This is particularly pleasing to me that this convening would happen here at Medgar Evers College this year, because had Medgar Evers lived, he would have been 100 years old. And so thank you for choosing Medgar Evers College for the convening. Welcome to each of you who have not been to Medgar Evers College before. And for those of you who have been to Medgar Evers College, welcome back. And I look forward, and I hope you look forward, to an excellent evening, keeping in mind what the pastor just prayed. Thank you, and again, welcome to Medgar Evers College.
Before I introduce our DCAB members, I just want to reiterate our purpose here this evening. The purpose of this hearing is to gather input and insights from community members, stakeholders, and experts to inform the work of the DCAB in really making the thoughtful recommendations on where $750 million of capital funding should be allocated for SUNY Downstate Hospital. You will hear more this evening, but I am happy to inform that SUNY Downstate is not closing. We want to make sure that that is the first thing that, for the hearing, before the testimonies start, I am going to reiterate a couple of times this evening, SUNY, this is not a hearing about SUNY Downstate Hospital closing. This is good news. But there is a hard task, and the task is how do we allocate $750 million towards SUNY Downstate Hospital, and we want to hear your voice. So with that, I'm going to introduce our board members, and then we're going to set some few rules and protocols for this evening so that we can make sure that everyone is heard this evening and that we will end at a decent time. There's some real serious goals, but the most important is that we want to hear your voice. And you also have an opportunity, if you still would like to submit a written testimony, we are still taking written testimonies, and also want to let you know there will be a third public hearing on March 13th. Okay? So, our distinguished Downstate Community Advisory Board. We're going to start. I'm just going to ask if you just say, hello. We don't have to, if you want to say just a couple of words, but we're going to start with Dr. George. Dr. George is the chairperson of the Department of Community and Family Health for SUNY Downstate. I'd like to say hello.
A pleasure. Thank you.
Dr. Kennesaw, or as we call him affectionately, Dr. K, is a healthcare leader and advocate. Please. We have Chancellor Dr. John King, Jr., Chancellor of the State University of SUNY, New York. We have Dr. James McDonald, is the New York State Commissioner of Health. He is joining us via Zoom. We have Dr. Moore, who is a physician and advocate for healthcare workforce development. We have Andrew Ryan, who is the president of Citizens Budget Commission. We have Pastor Louis Straker, Jr., who's the founder and lead pastor of Reflections Church. And we have Claire Patterson, who is retired COO of New York City Health and Hospitals Community Care. And Dr. Cowell, who is running a few minutes late, but he is the president of the United University Professions Union. So I'm not sure, is Debbie Lewis, did she make it in yet? Where? Hey, how are you? Okay. I am happy to introduce Debbie Lewis, who is the Assistant Secretary, New York City Intergenerational Affairs, Office of Governor Hochul, to bring greetings. Updates, thank you.
No, I'm just gonna do it from here. Oh, you wanna play the video? Yes.
Good evening, everyone. I'm Governor Kathy Hochul, and I want to welcome members of the public to the very first meeting of the SUNY Downstate Community Advisory Board. I know how passionate members of this community and your elected officials feel about the future of SUNY Downstate. That's why today is such an important day to launch an effort to ensure your voice is heard. Over the past year, we've been working on a solution for SUNY Downstate. The legacy of this hospital is deeply personal to me, because every New Yorker deserves reliable, world-class health care in their own community. In the last budget, I worked with the legislature to secure $300 million to support the facility. We also established a community advisory board to develop a fiscally responsible, long-term plan for a stronger, better SUNY Downstate. For months, my administration has engaged in conversations with the Brooklyn community and your elected leaders, all to ensure we selected the right individuals for this board. I'm confident these members will conduct a robust community engagement process and develop comprehensive recommendations to secure SUNY Downstate's future. This week we celebrated Dr. King's birthday, and in the spirit of his legacy of justice and equality, we must continue to fight fiercely on the side of righteousness. After decades of disinvestment, we're finally moving toward building a modernized SUNY Downstate facility that'll deliver high-quality health care to the central Brooklyn community. That's why today I'm proud to announce that in my budget, we're allocating an additional $450 million on top of the $300 million that was committed last year. All this is to implement your community's vision and further strengthen our commitment to this institution. This is a once-in-a-lifetime opportunity to reimagine SUNY Downstate together. I look forward to receiving the advisory board's final recommendations this spring. Again, I want to thank all the elected officials for their strong advocacy, and I want to thank you for being part of this process here today.
Good evening, everyone. Again, my name is Debbie Lewis. I'm the Assistant Secretary for Intergovernmental Affairs for Governor Kathy Hochul. As you can see, that video was shot for the first CAB meeting that we had, but we thought it'd be relevant for the information to be shared again so that you can see it, because I know we have some new faces, folks that maybe have joined on Zoom or did not come in person, so we wanted to make sure that we shared that video. So thank you all for being here. Thank you to OMA and our esteemed board. They have been phenomenal. They're unpaid, and they're working tirelessly to make sure that we have great outcomes in Central Brooklyn. So thank you again for your tireless advocacy on this topic. I just want to go through the statute for the Community Advisory Board, just to ensure that everyone has the information about what should and will happen once the board concludes their work and while they're continuing the process right now. So this advisory board is comprised of 9 members, which OMA has introduced all of them to you already. In conducting the study, the advisory board will consider the following factors in their report: overall healthcare service delivery trends and models, historic and projected financials for the hospital and the campus, current state of building infrastructure and capital needs, community healthcare needs, outcomes and health disparities, existing inpatient and outpatient service offerings and health outcomes, capacity and availability of inpatient and outpatient services in the broader primary and secondary service areas, efficiency of operations and quality of healthcare services benchmarking, and training needs for students and employment outcomes. These advisory board members shall also solicit recommendations from healthcare experts, county health departments, community-based organizations, state and regional healthcare industry associations, labor unions, experts in hospital operations, and other interested parties. The advisory board shall hold no less than 3 public hearings. We're on number 2. And in addition to that, again, they are uncompensated, so thank you for your service. With that, their recommendations shall come to the governor by April 1st, including the Speaker Pro Temp and the President Pro Temp and the Speaker of the Assembly. In addition to that, this report will have reasonable recommendations, and it must be a written report, and this will be presented to them so that it can continue the process. The money is already allocated to the hospital, but it will help to produce whatever the outcomes in the report. After that, the last part of the statute reads the Certificate of Need. The Public Health and Health Planning Council and the Commissioner of Health are prohibited from reviewing or approving any Certificate of Need application related to a reduction in inpatient services pursuant to any article of law or regulation that may affect a change to inpatient services at SUNY Downstate Health Sciences University until April 1st, 2025. So that is the statute. It is public record. I just wanted to make sure that you all had that. If you should have any questions in regards to the governor's position and investment, I am here. You can contact me or you can tap me on my shoulder. I'll be sitting on the left side of the room. Thank you again. And Oma, back to you. Thank you.
Okay, this is the fun part. But before I do that, I also want to thank, we have James helping out with the tech from Medgar Evers and Angelo, who is recording. So I'm saying that so everyone knows this hearing will be fully recorded, and a copy of the recording will be on our public site, which is downstateadvisoryboard.org. That is a public site. So I just want to inform everyone that all testimonies will be recorded and will be available for the public on that public site. Okay, we are also asking that everyone stay within 2 minutes. I already hear the grumblings. 2 minutes. So, to help facilitate this process, we have this nice little timer here, which will go off in 2 minutes. And I will gingerly and nicely remind you, it's 2 minutes. Okay, so, but please, to also help facilitate this process is that we know everyone has a lot to say, and some of you may have a continuation from the first public hearing. But this is the question that we really want everyone to address. The question is, okay, is it better if I do it this way? Here is the question that we are asking. How should the $700 million in state capital investments be allocated to best modernize and revitalize SUNY Downstate Hospital? What specific improvements should be prioritized? That is the question that we would like to hear what your thoughts are and your recommendations in 2 minutes. Okay? So without further ado, we do have a number of representatives that are here with us today. I would like to introduce first, because he does need to leave shortly, but if I can ask if Roderick Daly, the chairperson of Community Board 17, if you could please come up and say a few words. Do you want to, Well, you can come, I usually have them come up here for the like this.
I get to sit in your chair too. Good evening, everyone. Bringing greetings, President Ramsey, to the CAB, and to everyone here. I just want to bring greetings on behalf of Community Board 17, and what it is that we are honored that SUNY Downstate, which is right in the district of Community Board 17. We're very pleased to have it, and I know that there's some board members here, and I always like to recognize our board members who are here. So just quickly, just stand and wave. Board member and district manager, right, from Community Board 17. Thank you. I know district manager's in the back. Just real quick, because I know time is of the essence, just to state that Downstate is a staple, and we're working towards keeping the staple within our community. I do have two major asks. Ask number one, and thank you to Dr. Rubinowitz, who's in the back, for that reminder, to make sure that the SUNY part stays in, right? So the SUNY part is the medical school, right? And so the SUNY part stays in along with the hospital itself. So both of them should be considered when we're doing things. How do we improve both the university and how do we improve the hospital at the same time? So those two things, I would like that to happen. The second thing that's very important to me is as a patient, you want to feel like, you ever get that phone call, how is my customer service? 1 out of 5 if it was great. And that means that attention is being paid. So we want to look at how can we improve staff to patient ratio. Staff meaning both nurses and PCTs. How do we do that? And the other thing is infrastructure. How do we build the hospital? Maybe build up, build out to increase, 14 seconds, wow, to increase participation of other individuals and invite more than the 1.8 million individuals that are there. So I just close with the following. We need to reinvest some of the money so that we will continue to stop being dependent, right, and have these kind of meetings. We'll work hard together as a community and as a hospital to ensure that the 1.8 million people that we serve, they will continue to serve. Thank you very much.
Okay, I don't know. So, Dr. Cowell, I want to introduce Dr. Cowell, who's joined us. We did introduce you, but I just wanted people to acknowledge that you're here. So tonight, we are represented by all 9 members of this very dedicated board. So I think they deserve another round of applause for being here. Okay, so I would like to introduce our Deputy Borough President, Reverend Kim Council.
Thank you so much, Ms. Holloway, to President Ramsey, to Dr. King, and to the CAB, and to all of you who are gathered here tonight. Good evening to members of the advisory board, and thank you for holding these hearings so that the public can weigh in on the future of SUNY Downstate, an integral part of the East Flatbush community for almost 60 years. As was shared, I'm Deputy Borough President Reverend Kim Council, and I'm here representing our Borough President, the Honorable Antonio Reynoso, and the thousands of our constituents who depend on this critical institution. We are pleased that Governor Hochul has pledged almost $1 billion over the next 2 years to support Downstate, and we hope that this represents a significant step toward planning for the hospital's long-term fiscal security. as it is currently the only academic medical center in Brooklyn and the only the only state-run hospital in New York City. Additionally, it is only one of 2 regional perinatal centers in Brooklyn which offer the highest level of obstetric and neonatal care. Downstate is also the home of multiple centers of excellence, such as those for cardiovascular care, including thoracic and vascular surgery and renal care. It is important to emphasize where Downstate is located. It is in a predominantly low-income Black community that experiences higher than average levels of chronic diseases such as hypertension and diabetes, as well as elevated rates of adverse obstetric outcomes such as low birth weight and maternal health. The presence of an academic medical center capable of delivering high-quality care to patients in this area of Brooklyn is thus essential to eliminating the health inequities seen in this population. And so, like the chair of CB17, we want to make sure that that is fully invested in. Moreover, SUNY Downstate is the only kidney transplant center in Brooklyn. It is critical that people are able to access health care as impactful and important as kidney transplants in their home borough rather than having to travel. As someone who has donated a kidney, understanding that New York City is 50 out of 50 when it comes to live donations, I believe that this is an important and critical service that we provide. And we need to continue to provide. 30 seconds, good Lord, you give a preacher 2 minutes? I'm gonna go to my last paragraph. We want Brooklyn to be a leader in delivering excellent health care, and we do not want our constituents to find it necessary to have to go outside of the borough. It is for this reason that we, Borough Hall, are committed to keeping SUNY Downstate open. We know that that's no longer on the table, but we want to make sure that you're thinking about the uniqueness of this hospital and the things that it offers to the community. It is the only place that in Brooklyn that offers kidney transplants. It's high tech when it comes to OBGYN, and we know that Brooklyn is one of the least safe places for women of color to give birth. So these are areas in which I think we need to focus our attention and make sure that we are continuing to educate the next group of diverse medical professionals. Thank you.
Thank you. I think, okay, do we have a representative from the office of Senator Prasad? This is T. Strong, right? Thank you. T. Strong is representing the office of Senator Prasad. Thank you.
Good evening, everyone. My name is actually Taniqua Strong, but it's easier to say T Strong. And I have the opportunity to represent the Senator Roxanne J. Prasad, which represents the 19th Senatorial District as our Chief of Staff. As you know, one of the things that Senator Prasad believes in is health equity. And so that is one of the things that she wants to make sure that is promoted is health equity. One of the things that she shared is that even though SUNY Downstate is not within her district, it is the community's hospital. And Senator Prasad is going to do anything in her capacity to make sure, as she works alongside of her colleagues, to ensure the everything that SUNY Downstate is looking to perform, that it occurs. And so on behalf of Senator Prasad, know that she is here for SUNY Downstate, the community, and our office is available at any time. Thank you.
Next, we have Chris Smith from Assemblywoman Monique Chandler Waterman's office. Oh, okay. So we will hold off until the assembly member arrives. Do we have Fred Baptiste from Community Board 9.
I want to thank everyone for coming this evening. I want to thank the the Downstate Advisory Board. I want to welcome everyone to Brooklyn Community Board 9. I had an opportunity to speak before the advisory board, and I just wanted to reiterate some of the points that we had from last time, where we want to make sure. I mean, I know that $750 million is a significant investment, but given the history and given the severity of the issues and the challenges that we face at Downstate, I wanted to make sure that we're very clear that this has to only be a beginning step in terms of what are we doing to revitalize. I also wanted to share that, you know, I do have concerns, and while I'm looking at the document, I do appreciate all the work that's gone into starting to craft recommendations, but I am concerned about as well the decrease, actually, in the number of beds. I think that we do need to think critically about how Downstate fits into the overall health network in Brooklyn. We are only 5 years removed from COVID. It was a hard time. Downstate definitely understands that as well, but we also want to make sure that our health network is resilient. We want to make sure that there's capacity there. I think it's also important for us to have additional information with respect to, again, not to necessarily rehash and open old wounds, but understand how we got to this point and understand what is being done differently. I think one of the concerns we have is that we understand is that Downstate serves a lot of poor people. And we need to discuss what is going on with reimbursement rates. We need to discuss what is the appropriate mix to make sure that it is going to be viable and sustainable. We need to discuss what partnerships perhaps we should be considering in terms of making sure that we're able to achieve all of the goals that we have. It's important that we understand Downstate is a public hospital. It's not here to make money, but that means that we need to make sure that there is a public investment that's steady and that continues with that as well. So we should be looking holistically at everything we need to fix. You know, if it's roofs we need to fix and everything, I think we need to be having that conversation. But we need to be very clear-eyed, and I definitely want to start the drumbeat in terms of, while I respect the work the advisory board is doing, to say that we're going to have solutions by April is ambitious, to say the least. And I think that we need to start considering in terms of having conversations with the legislature to expanding this community advisory board, because I believe the solutions are going to be long-term. It took us 50 years to get here. It is going to take us more than a year to actually develop the solutions. So we should be looking holistically at what the 5-10-year plan is for making sure Downstate is everything it needs to be. Thank you.
Okay, I want to make sure that, have we acknowledged all of the elected officials and community? Oops, hi, I'm sorry. Oh, okay, please, we have us, Assembly Member Farah Sufant Forrest, correct? If you could please come up, please.
Hello, good evening. My name is Justin Freeman. I'm Assembly Member Farah Sufant Forrest, Director of Community Affairs and Constituent Services. I wanted to extend thanks to Dr. Ramsey and the Advisory Board from the Assembly Member. And I'm super grateful for the activists and politicians that managed to keep Downstate open for us for all the reasons that everyone had mentioned. If it wasn't for them, we wouldn't have Downstate, right? You know, the Assembly Member is a nurse. I think she worked in Kings County Hospital. I was born in Kings County Hospital, so just like the hospital complex there is so important to Flatbush. But my mom, she relied on Downstate Hospital to stay alive. But like many of us probably in here, received inadequate care from there. And we had to take her to NYU Langone in Manhattan and pay for Ubers and buses and trains. So I'm hoping this $750 million goes towards providing adequate care to Black women and brown women and working class women like my mom, right? I want to feel a sense of pride about Downstate. I mean, you used to be able to go to, it used to be a time, Kings County used to be, you go in with a cold and never come out. And I felt like that almost happened to my mom in Downstate, right? And I don't want that to happen for anyone. One of the things that I'm thinking about is like how that $750 million is used to increase outreach in the community, to provide scholarships for students that come from the area, so increasing the outreach and community engagement with kids in the area so that we have Black and brown kids that come from the area working with, you know, community members potentially here. And yeah, I'm just excited to hear about the ideas and comments from people in the area. Thanks so much.
Okay, we are now going to hear from you. We are expecting the Assemblymember Latrice Walker is on her way, and the Assemblymember Monique Chandler Waterman is on her way also. So, but in the interim, I think it's time for us to hear from the public. We do have 2 mics. Our preference is that if you can line up at that mic, I'm going to call a few people at a time, and but if this is more convenient, please feel free. We're not going to ask you to go all the way around, but that is the mic. You are addressing the DCAB board members. This is who are there taking notes, they're listening. This is, you know, so I just wanted to be clear because some people look my way. You don't have to look my way. I'm just the moderator. Okay? These are people, the DCAB board members are who are listening and want to hear from you. So we are going to start with those who registered first, but we do plan to get to anyone who signed up to speak today. And as I said, you are always free to submit a written testimony, especially if it goes after 2 minutes. And my co-facilitator here, Lynette Battle, we will be putting on the sign, so you will hear the 2-minute mark. But we do appreciate that if there's anything more you would like to add, or if you brought something that's written, please feel free to give it to us, and we will share that with the members. Okay? So we are going to start. I'm going to call about 3 or 4 people at a time. Marianne Banerjee, Sohia Salas Brockwell, and I'm going to apologize first if I'm not saying names correctly, but so I do not mind correction. Joya Ahmad, Jesse Ortiz, and when you, before you speak, if you can just give your name.
Am I up first? All right.
Yes. Yep.
Good evening. My name is Joya Ahmed. I'm a 4th-year medical student and a president of Downstate University Student Council. I am here tonight to advocate for the $750 million from the state of New York to be used to maintain and improve Downstate's hospital as a fully functional facility with inpatient and specialty services that remains connected directly to the medical school and all of its other health sciences programs for the benefit of us and the patients we serve. Many of us came to Downstate because of the mission statement to provide outstanding education of healthcare professionals and to care for and improve the lives of our globally diverse communities. We cannot achieve an outstanding education without a home institution, and we cannot provide quality care for our globally diverse communities without the equipment and facilities to do so. Currently, both our education and the quality of care received by patients suffer because we lack adequate equipment and facilities for imaging, radiation oncology, and cardiothoracic surgery, just to name a few, meaning that many patients are forced to travel to other hospitals for such services. This is not only an undue barrier to care for our patients, but also an opportunity that students are missing out on to learn and pursue valuable career paths. A significant part of this $750 million should be utilized to enhance imaging services, purchase necessary equipment, and update the physical facilities. Funding must also be allocated to the preservation of the transplant program, which is deeply necessary for our community and a unique learning opportunity for our students, our obstetric and gynecologic services, so Downstate can remain a regional perinatal center, and our emergency room, which is in deep and dire need of more space and an observation unit. Using the funding in these ways will not only improve the quality of services, but allow students to achieve the ultimate goal of our schooling, which is to provide comprehensive, excellent, and patient-centered care. We are students, which means we are here to learn. but we are specifically healthcare students, which means we are here to serve, to help, and to care. Many of us, like me, live in Flatbush, in community with the patients we care for. So this is not just about our school hospital, it is about our home. I came here to this community-centered health sciences university to become a community-centered physician, and I want future generations of students to be able to do that too. So please do right by us and the patients we care for by using this money to keep Downstate fully operational. Thank you.
Not trying to be biased, but I think she set the bar. In 2 minutes, exactly. Thank you very much. Okay. Yes, if you would like to give your name, please.
Good evening, everyone. I'm Madhvi Jere. I'm a third-year MD PhD student and the graduate student representative in University Council. I focus on translational research, connecting what we do in the lab to what we see in the clinic to improve health outcomes. I study dementia, and the current standards for research rely heavily on robust infrastructure. These include specialized facilities, storage capability and equipment, for example, longitudinal brain scans using MRI imaging as well as PET scans to monitor disease progress. This work is essential in informing the next generation of therapeutics. But unfortunately, the majority of the research in the field right now is based on white subjects of higher socioeconomic status, leaving our data biased. I came to SUNY Downstate because I wanted to work with a diverse population, both as a clinician and as a researcher. I'm consistently amazed at the dedication of our faculty and their long-standing relationships with both the patients and the local community. However, we lack the resources to support translational research. We need more MRI machines, PET machines, freezers, incubators, and dedicated updated lab space to get there. Without this, instead of bringing the opportunities for our patients within their local community, they would have to travel elsewhere for imaging and for follow-up. This increases the barriers for enrollment for an already underrepresented population. Additionally, we as students acutely feel the lack of mentorship opportunities. Without the infrastructure to support translational research, physician scientists are not coming to Downstate. Our MD PhD program is one of the longest running in New York City, and I believe that we can become one of the best ones. SUNY Downstate, as has been mentioned before, is the only academic medical center in Brooklyn, and we owe the community the chance to be represented in research. This will only be possible if we improve the infrastructure at University Hospital. Thank you.
Thank you. I see that we have Assemblymember Brian Cunningham. Would you like to say a few words now, or you would like to keep us going? Okay, then we'll come back to you. Thank you. Isaac Vingen. Okay, I have Rachel Ball-Jones, Dr. Edward Powers, and Amy Affable. Okay. Please.
Thank you. Good evening. I'm Isaac Vingen, an MD PhD student and the Vice President of the Student University Council. I am proud to say that I have been a dedicated student and scientist at SUNY Downstate for the better part of a decade. I'll get right to the point. You want to hear how we want to spend the $750 million from the state of New York. That money should go toward maintaining a fully operational hospital with inpatient services exactly where it is, physically connected to the school. A hospital at Downstate Health Sciences University is necessary for the education of our students and the retention of our faculty. You may have already heard that 30% of medical students are learning at University Hospital Downstate at any one given time, but that statistic misses the whole truth. 30% is in reference to third-year medical students. When you include fourth-year medical students, students in the School of Health Professions, and students in the School of Nursing, you are looking at nearly 40 to 50% of all rotating students learning at UHD at any one given time. Without a guaranteed home institution to rotate at, there simply are not enough available spots in the borough of Brooklyn to host me and my peers. If you turn our attention to the classroom, nearly 60% of medical school classes are taught by UHD clinicians. Nearly 50% of student research opportunities are sponsored and hosted by UHD clinicians, and 100% of clinical lectures are taught by UHD clinicians. We need an inpatient hospital attached to SUNY Downstate, because if we rely on other hospitals to attract talent for us, we will not be attracting the best and brightest. Our practitioners are here because they want to work at an academic medical center. Our researchers are here because translational research opportunities attract Nobel laureates. Our students are here, I am here, because I want to learn at this hospital, get taught by these faculty, and care for this community. Thank you.
Thank you. Thank you. Thank you.
Thank you, everyone. Amy Afable, Associate Dean for Community Engagement and Associate Professor of Community Health Sciences at the School of Public Health at Downstate. The Central Brooklyn community Downstate serves continues to confront a public health crisis. I am here to provide a public health perspective and collectively, with some of my colleagues in attendance today, advocate for the integration and investment of a public health workforce that has historically been undervalued. But that has the expertise to care and address the unmet social needs of our highly vulnerable patient population, community health workers, social workers, and doulas. There is extant evidence that community health worker interventions, for example, are low cost and effective at promoting health. A CHW program, for example, that addressed unmet social needs implemented at the University of Pennsylvania Health System found a return on investment of $2.47 for every dollar invested annually by Medicaid. With support from the NIH in 2022, the School of Public Health, Department of Obstetrics, Gynecology, and the Arthur Ashe Institute for Urban Health developed a high-impact, community-informed, community health worker-led intervention called We Care About Brooklyn, designed to address the central Brooklyn maternal health crisis. Some key intervention components include addressing health-related social needs through digital care coordination, ensuring closed-loop referrals to address food insecurity, financial insecurity, basic infant supplies, community health workers providing urgent warning signs, education, and a vital link to urgent care to prevent severe maternal illness, escalation protocols for patient concerns about perceived discrimination and implicit bias, and finally, scheduled check-ins to build patient trust. Our pilot randomized control trial of WeCAB, We Care About Brooklyn, led to a 96% lower odds of likely depression. Stress levels are also lower in WeCAB group versus control. The strong partnership between School of Public Health, Arthur Ashe Institute for Urban Health, and other schools at Downstate provide a unique position and also provides academic and community expertise in developing models and initiatives advancing evidence-based, patient-centered, equity-focused care. As Downstate is undergoing a transformation, we believe we are uniquely positioned to deliver solutions that ensure that families do not fall through the cracks, which often can be fatal.
Thank you. I will ask if you would like to turn, your what you have written. Oh, okay. Thank you. Thank you. That was just that was the summary. That was the executive. But thank you. Thank you very much. I see that we have Assemblymember Latrice Walker is here. Would you like to say a few words now, or would you like to hear a couple more? Okay. Assemblymember, if you could come up here. Yes, you get to come up here.
Sorry. Awesome. Thank you, everyone. I get to sit in this chair, too? Oh, this feels good. So, good evening, everyone. It's a pleasure to be here in the beloved community. Of course, here at Medgar Evers College, I want to give greetings to President Ramsey for your leadership. We believe that this hearing is right where it needs to be, in a community built location, a community-served location, a community-run location, in support of another community-built location, community-served location, community-led location. So I just wanted to add my voice to the voice of the community about the vision and the vitality of SUNY Downstate. We have heard the chants. We have all participated in the chants. We know it so well, our children knows them. Brooklyn needs Downstate. Brooklyn needs Downstate. Brownsville needs Downstate. Ocean Hill, Brownsville, and which is why I'm here. Of course, we know that we have a number of social net hospitals within our communities. And when we lose them, like we lost St. Mary's Hospital where I was born, we know the devastating effect that it has on our community. Our health is our richness. Steve Jobs had all the money in the world, but he could not pay $3 trillion to save his life. And so we know that there is no investment that is too much for our health, our safety, and our wellness. And so on behalf of New York State's 55th Assembly District and the thousands of constituents who are served by SUNY Downstate, including myself, I walked into SUNY Downstate one year and I was MPO. There was nothing I could take by mouth. If it were not for the nurses and the doctors at SUNY Downstate, who knows where I would be? Perhaps 6 feet under. There were people who were coming into the hospital, and the moment that they looked at me, they just started crying. But it was those very same doctors who spoke life over me and who gave life back to me, to which I am eternally indebted to the building. So I want to acknowledge each and every one of those individuals and acknowledge everyone who are respecting and responsive to the needs of the community, the patient, and the staffs there. We want to say kudos to the tireless advocates and union members and lawmakers who are making this day a reality. Quality health care should not depend on one zip code, on one's bank account. Communities of color need SUNY Downstate. It is a vital safety net hospital that treats everyone who walks through their doors, regardless of their ability to pay. In fact, 90% are on Medicaid and are uninsured or underinsured. Most are people of color with limited access to quality health care, which ought to be a basic human right. We have to be very intentional going forward in a very limited time about charting the future of this hospital, and I want to thank the board for the important work that you are doing. The failure to carefully and strategically plan for the future's hospital might actually exacerbate the healthcare disparities that already exist in our communities. And the failure to save SUNY Downstate will decrease life expectancy and send a message to some people in power that some people in power don't care if we live or if we die. We know that our life expectancy is just about 75 years old. It's the lowest in New York City, according to the Department of Health. SUNY Downstate is the only hospital in Brooklyn with a kidney transplant program, and my mom just died of end-stage renal disease, so I know how important this is. If we don't get this right, more people will die and more people will suffer. If we don't get this right, members of this hospital's workforce could lose their job and they will suffer. So we are concerned. We know that the public has something to say. And I thank you very much for allowing me this opportunity as we consider pushing back the April 1st deadline so that everyone has a chance to weigh in on the future of this hospital. Thank you, beloved community. I am Assemblymember Walker.
Thank you, Assemblymember. I do want to thank the community and Assemblymember Walker in particular, because it is important that we do these public hearings correctly. I also want to thank members of UUP and other representatives of SUNY Downstate that any ways that we can improve and make sure that we've communicated effectively, and make sure this is properly represented. It came from you. So in addition to your statements and testimonies, we do appreciate your feedback to make sure that we're doing this correctly. So thank you, and thank you, Assemblymember Walker. Oh, and you know, and I know that I'm going to hear that it was, we didn't give you the 2-minute buzzer. But you know, since you had walked in, we didn't reiterate the rules, but we appreciate everything that you said, so thank you. Okay, I just want to, we now have a couple of, you know, I do want to make sure if any new people have come in, just to make sure that I'm keeping up. Vicky Small, Shane Solger, Faven Araya. Did I say it correctly? Araya? And Ian Peak. Okay, thank you.
Dear members of the Downstate Community Advisory Board, to modernize and revitalize SUNY Downstate, we must prioritize investments that improve care delivery, drive innovation, and address the specific health needs of our community. My name is Vicky Small, and I support Downstate's patient-centered medical home initiatives, leading evidence-based efforts to strengthen preventive care, implement digital health strategies, and close critical gaps in early detection. At SUNY Downstate, where 78% of our patients are Black or Afro-Caribbean, we see persistent disparities in colorectal cancer, diabetes, hypertension, and other preventable conditions. Black adults are 40% more likely to die from colorectal cancer due to low screening rates and delayed diagnoses. Many patients face barriers to screening, including limited access, misinformation, and difficulties navigating the referral process. Late-stage diagnoses increase treatment costs, strain hospital resources, and worsen patient outcomes. Through evidence-based strategies, we have made measurable progress in CRC, or colorectal cancer screening, and preventive care. We've optimized our EHR workflows to improve referral tracking and follow-up, increasing our colorectal cancer screening referrals by 200%. We trained primary care docs and specialists to improve care coordination and streamline patient navigation. Developed a multilingual digital health campaign in English, Haitian Creole, and Spanish to address misinformation and increase screening completion rates. We've planned targeted digital outreach through YouTube and text-based education to ensure patients receive accurate, culturally relevant information the way they want to get it. While these advancements have been proven effective, gaps remain, and state capital investments must be used to expand, scale, and innovate beyond these initial successes. To modernize Downstate and strengthen its future, we must invest in solutions that improve early detection, enhance efficiency, and drive healthcare innovation. By investing in preventive care and digital health innovation, we can modernize how care is delivered, reduce long-term care healthcare costs, improve provider efficiency, strengthen Downstate's financial stability, and position Downstate as a leader in patient-centered, technologically driven healthcare.
Thank you.
Thank you.
Thank you.
Very quickly before I get started, I'll be speaking on behalf of my director, Faven Araya, okay? Awesome. So good evening, everyone. My name is Christelle Pierre. I'm a Senior Health Equity Research Coordinator at the Arthur Ashe Institute for Urban Health. We are a nonprofit organization based in central Brooklyn, New York, housed within SUNY Downstate Medical Center. And our central mission is focused on promoting health equity and social justice. So presently in New York City, there is a pronounced racial ethnic gap in maternal mortality outcomes, where in between 2016 and 2020, the black and white difference in pregnancy-related death outcomes was found to be 6-to-1, with the key drivers being fragmented care, inadequate risk assessment, and follow-up care, in addition to the dismissal of patient concerns due to race. Since its inception, the Institute has established and nurtured a unique partnership with SUNY Downstate, collaborating on a variety of initiatives, with the most notable being the establishment of the SUNY Downstate Women's Health Community Advisory, also known as the Women's Health CAB. At the core of this community academic partnership is the collective mission to eliminate disparities in women's health throughout Brooklyn through cross-sector collaboration and equity-driven action. To address the pervasive maternal health disparities that we see, our recommendations are to institutionalize as well as amplify the work of the Women's Health CAB, and we propose the following. First and foremost, we want to leverage the existing capital funds allocated to Downstate to invest in the infrastructure, the workforce, and quality improvement efforts to ensure the continuity of care. Second, we want to invest in the integration of social service providers to address the social determinants of health needs of the community and provide holistic patient-centered care. Third, we want to promote synergy with existing policies such as the 1115 waiver to further supplement and enhance the existing funding streams. Lastly, we want to leverage the community academic partnership between the Institute and Downstate to co-lead this endeavor and effort. Now is a pivotal time as Downstate is undergoing this transformation. We are positioned and are primed to support and care for the Central Brooklyn community in ensuring that women and families do not fall through the cracks, as Dr. Afable mentioned, and that are not disproportionately affected. I implore you to take this into consideration. Thank you for your time.
Thank you. Did you submit that as part of the written testimony? I'm sorry, did you submit that as part of the written testimony? Would you like to give that to us? Great, thank you. I'm honored to have our Congresswoman, Yvette Clarke. She's here with us today. Would you like to come up and say a few words, please? Congresswoman, there's a nice chair here with the microphone. I want to make you very comfortable.
Thank you very much, Madam Mistress of Ceremonies. Let me start by thanking Dr. Patricia Ramsey, President of Medgar Evers College, for hosting this evening's convening, and to the distinguished advisory panel for your hard work and dedication to the mission of healthcare here in Central Brooklyn, to the beloved community here gathered. Thank you for taking the time from your busy schedules to be here to voice what I believe is a majority view of those of us who reside here in Central Brooklyn, of the value of this great institution. It's great to see everyone here, but before I begin, let me just say what a distinct pleasure it is to be with you today and to thank every dedicated advocate who has been at our side for tonight's critical discussion. I am Congresswoman Yvette D. Clarke, and I proudly represent New York's 9th Congressional District, which is located in Central and Southwest Brooklyn. I also serve as chair of the Congressional Black Caucus in Washington, D.C. for the 119th session of Congress. And I just got in from Washington, D.C. It has been a very challenging time for us, to say the least. I know you're all feeling it as well. As a matter of fact, this week a budget was passed on the floor of the House that is looking and seeking to cut $880 billion out of the National Treasury. Most of that is aimed at Medicaid and Medicare. So as we put this in context, we have to think about the battle ahead, and we have to include in our vision of a state-of-the-art healthcare facility known as SUNY Downstate, what we must do to preserve a lifeline for SUNY Downstate, which is Medicaid. For years, SUNY Downstate and the many healthcare heroes who support it have delivered life-changing care and assistance to the people of Brooklyn and to others from across our city. I've been a direct beneficiary of the care at SUNY Downstate, and so this is very personal for me as well as my family. They saved my father's life on 2 occasions. He's now chilling in Jamaica at the age of 88. We will never forget how you were there for our families throughout the pandemic, nor can we ever repay that debt. And I'm so proud to have worked at your side to ensure that SUNY Downstate remains open and accessible for the countless families who depend on this true New York institution. I pledge to continue my advocacy and fighting to ensure that this facility and the many doctors, nurses, allied healthcare professionals, administrative staff, and many other stakeholders who define SUNY Downstate, our students at the medical school, will always be able to continue their life-saving work. Together, I am certain we will ensure that SUNY Downstate will keep thriving in its next chapter, and we will be empowered to serve the people of New York, and it will be empowered to serve the people of New York for generations to come. You know, I know that our state is challenged, but I've never seen an administration that when they're dedicated and committed to making things work, they haven't been able to do so. Let me say that there's a lot of lip service paid to diversity, equity, and inclusion. Some of that lip service is good, some of it not so good. But at the end of the day, we know right here in Central Brooklyn, there's an institution that has been committed. There's a governor who has said that she is committed. And if that is the case, like so many other places across this nation, we can develop a state-of-the-art 21st century healthcare institution called SUNY Downstate. We're all in a fever right now, but when the fever breaks, we want to say that we stood together and future generations are now going to participate in healthcare delivery system that is reflective of their humanity, their dignity, that it will provide all that we need in terms of research and development to address the disparities that some of the testimonies have spoken to this evening. We can do this. And I know that where there's a will, there's a way. Having said that, enjoy the rest of your evening, and thank you for having me.
So we have, thank you, Congresswoman Yvette Clarke. Let's give her a hand. This is like, we really need to thank you for all that you're doing, and it's tough times, that's all we can say. But thank you. I see that Assemblymember Monique Chandler Waterman, you're here. Would you like to say a few words, or you want to hear a couple of people? No, not yet. No. He didn't speak yet. I don't want you to come. But if you would like to speak, come on in, please.
Thank you so much. Thank you. Sorry, just came off of a 3-hour ride from Albany from the housing hearing, and I'm a little bit under the weather, so I'm trying to get my bearings here. But I'm Assembly Member Monique Chandler Waterman, representing in Brooklyn, Assembly District 58, covering East Flatbush, parts of Canarsie, Brownsville, and Crown Heights. So I want to begin by thanking SUNY Downstate Community Advisory Board and all who organized today. I'm proud as a state elected to say that SUNY Downstate Hospital is open and is here to stay because of the collective efforts of the community stakeholders in this room, clergy, unions, my colleagues and I in the state, especially as you know, Senator Myrie and Assembly Member Cunningham. We got Latrice Walker here. And all of our heroes ensure that both the university and hospital runs to the best of their ability under the leadership of President Riley. You know we got to shout out Alicia Goodrich, keeping us on our toes. So this institution is vital to our community, and we need to support Downstate the same way they support us in time of need. I said this story time and time again. My daughter was born here. My husband got his diagnosis for diabetes from here. I've been treated here. Many of you have the same and similar stories. We need to make sure we heard time and time again, even today, about the kidney transplant, first ever. We hear about all the good things that SUNY Downstate has, and we need to make sure not the investment of the $750 million, but I know I hear some $1 billion, right, we're trying to get to, and then also making sure that there's time to make sure we hear all these vital voices, and that the timelines that's needed is happening. So I just want to make sure that we have all of those things in right order, and making sure that we do all that we can to make sure that we reach whatever deadlines with time. So I just want to say I look forward to seeing you at the next public hearing, and I apologize today. Like I said, I'm a little bit under the weather, but this is very vital to us. This is serious. This is our lifeline. We will fight whether it's below, whether 0 degrees. I got my Uggs. I got a Telfar one too, and I got my coat. So we're willing to take whatever we got to take. I stand with my community members 10 toes down, and that's who I support. It's the community members that make sure that this community keep on going forward. So it's not an I thing, it's a we thing, and we colleagues will be out there if we need to. Thank you so much.
Okay, I'm going to call a few names, so please, if you can line up. Well, thank you, Assembly Member. If we can have people line up at either mics and preference. Is this mic? So we have Ibrahim Ayu, Marilyn Frazier, Simon Rabinovitz, Jamel Henderson. I don't know if this is the Hyacinth Llewellyn. And once again, I apologize if I'm not saying names correctly, so please state your name once you get to the mic. And James Thornton. Yes, please. Yes.
Good evening. My name is Simon Rabinowitz. I am the Vice Chairman of Pediatrics. I'm a tenured professor in pediatrics. And for perspective, I joined the faculty in 1987, started a division of pediatric gastroenterology, and Downstate was one of the first programs to be accredited in the country. There are several reasons to be here. I'm going to skip over those and have them in the written material. In the 21st century, cooperation is at the forefront of all medical advances. In its role as an educational entity, the state must immediately embrace this concept. A shared infrastructure between the 4 medical schools should be established to have in a manner which is more efficient. A single electronic medical record, a single institutional review board, single virtual library resources, and ongoing collaborative projects which are incentivized through the state. Establishing a group that would seek industry-sponsored and investigator-initiated multi-center clinical trials would leverage the diversity of our campuses and lead to an influx of resources, as well as create opportunities for national funding and give us an opportunity to represent this community. 75 years ago, the state created a medical school across the street from a municipal hospital. The idea was to complement, not to create opposition to each other. All types of things that are designed to compete between the two must be immediately abolished, in the sense that a group needs to be created where clinical individuals, administrative representatives from each of the hospitals, as well as from the state, as well as from HHC, should form a strategic plan that includes satellite facilities to allow the two centers to jointly serve the needs of the community and maximize outcomes. Finally, the hospital should follow the HHC, which built a nice hospital for under $1 billion in southern Brooklyn, and must be the same for us. It should be placed on the site of the abandoned parking garage with plans to convert the present building into office, educational, and outpatient services once the new facility is available.
Thank you.
Based solely on this, we need a creative fiscal program that goes beyond $750 million. We need some city, and we need federal to represent that this is the largest inner city community in the country, and it needs to be supported.
Thank you. Thank you. Would you like to, thank you. Could you get that for me? I think there's a second set of bells. This is community. This is, we're all doing this together. Thank you.
Good evening. Thank you, President of the university. Thank you to the advisory board. My name is the Reverend Dr. James Thornton, the pastor of the Salem Missionary Baptist Church, the largest and oldest black church in Flatbush. Doesn't matter because they're all black now. Well, most of them are. Having said that, I'm happy for the opportunity to speak. I believe that this hospital is vital and necessary. I remember when they closed Caledonia Hospital, which was a few blocks from our church, so when someone had a challenge, they could go there. St. Mary's Hospital closed. I'm happy to know that this hospital will remain open. I think that part of this $750 million should be used to update our pediatric ward for young people who also need serious and vital medical care. The other issue that I have as a pastor is the customer service needs much to be desired. And so it is my hope that when the new hospital is developed, that something will be done about customer service so that when people have loved ones who are deathly ill, that they're treated with respect and with consideration. The other thing that I hope that some of these funds will be utilized for is for social workers. When persons do come out of the hospital and they need additional care and home services, that there will be a kind of bridge that will help them to negotiate these vital concerns. And then finally, I was here when one of the officers in our church lost her husband. And we came to the hospital, and there was no one that we could speak to. This lady is 88 years old and had to wait at least 2 hours before someone could come down to give some direction. That kind of thing should not happen, especially when everyone is a little bit on edge. And so how we care about people is very important. As I say, and I close, that people don't really care how much you know until they know how much you care.
Thank you. Thank you. Thank you, Pastor. Just also reminding everyone that the board is who you need to directly speak to. I just want, out of respect, I want them to see you and you to see them. But I do appreciate people looking at me over here. But thank you.
Good evening. For the record, my name is
Yes.
Faven Araya. I'm speaking on behalf of Dr. Marilyn Frazier, who was unable to join today, so I send her remarks. In 1992, when tennis champion humanitarian activist Arthur Ashe founded the Arthur Ashe Institute for Urban Health, he was intentional in creating the institute at SUNY Downstate Health Sciences University because of the population served by Downstate, a population that we all know that is disproportionately affected by poor health outcomes. He envisioned an organization that would address health inequities by creating innovative community engagement and research programs to improve health outcomes. We do this through our outreach in community settings, such as beauty salons and barbershops, where barber and stylists are trained to deliver health messages to their clients. Equally important to the message delivery is ensuring linkages to resources and clinical services such as those provided by SUNY Downstate. Arthur Ashe envisioned the diversification of healthcare workforce, which is essential to providing quality patient care to improve health outcomes. We accomplished this by collaborating with Downstate on the Institute's Health Science Academy program, which serves students in grades 6 through 12. The high schools who are students interested in pursuing health careers come to Downstate and are given the opportunity to be exposed to the various health professions, from nursing to physical therapy, research, public health, and medicine. They are able to see health professions that look like them and can envision the great possibilities available to them. Many of the students from schools and colleges at Downstate serve as instructors to our students, while faculty at Downstate serve as mentors for our high school students to conduct research and be provided with shadowing opportunities. Arthur also knew that it was important to impact policy, and that is why the Institute, in collaboration with SUNY Downstate and the Office of the Brooklyn Borough President, created the Health Disparities Center 20 years ago to address health inequities through partnership, community outreach, research, and training. Arthur Ashe may have been before his time in stressing the importance of community engagement and research, diversification of the healthcare workforce, partnerships, and policy. However, the mission and vision is still important today, and it is especially crucial in our current climate. The importance of Downstate as an institution is no less important than when Arthur Ashe created our institute, and I encourage the support of Downstate to enhance its capacity to serve the communities of Brooklyn. Thank you.
Thank you.
Hi, I'm Dr. Robert Ferrangi, and I'm not only I'm the chief of pulmonary and critical care at Downstate, but I also grew up in the neighborhood, so it's a community I care very much about. I'm here to support the plan that's been put forth. I think building a new facility will create a more dignified place to treat our patients, so that's a great idea. I also think we need to rebuild the services. Downstate has phenomenal doctors, phenomenal nurses, phenomenal staff. However, we don't have the services. They've been stripped away. I have to send patients for their lung cancer resections to Columbia or to Maimonides or other hospitals. It's not fair for the people that live in this community. Rebuilding these services will take an investment. Keeping them going requires having the volume to support that. And that means attracting doctors. You know, I have a very vibrant training program, and it's very interesting. I'm in clinic, and we're overwhelmed. There's such a demand for the services here. I think people in the community know that you're not only going to get medical care, you're going to get high-quality medical care. So we have a waiting list 2 to 3 months in clinic. That's not good enough. We need to attract doctors. I train phenomenal pulmonary and critical care physicians, and then what do I say? A lot of them are international medical grads, and they'll do their waivers, 3-year commitments in Texas, Oklahoma, Indiana. Why can't they do that here? Why can't they serve underserved populations here? We need more doctors, and you can build up the inpatient services, but you need to build up the outpatient as well, because that's what's going to feed these services once they're established. And lastly, cars are not evil. It makes it easier for my patients to come to clinic if they can come and they have a parking lot and they can park and it's accessible. Cars are not evil. When we build this facility, we should take into consideration access for our patients, especially elderly who depend on cars to get them from point A to point B.
Thank you.
Good evening, everyone. For the record, my name is Destiny Donawa. I know it's kind of hard to pronounce.
Thank you.
It's spelled different.
I appreciate that.
I get it. I'm a proud first-generation college graduate from Brooklyn, New York, from East Flatbush. I live 10 minutes from Downstate. I earned my Bachelor of Science in DMI from Downstate Health Sciences University in 2022, and that program changed my life. Coming from a lower middle-income immigrant family from Trinidad, I know firsthand how access to quality education can transform futures. As someone who has lived here all my life, I can firsthand say that SUNY Downstate must remain open and properly funded to serve those who need it most. Downstate Hospital is integral to the community, and so is the education it provides. Excuse me. Downstate's diagnostic medical imaging program provided me not only with the technical skills required to excel in sonography. Sorry, can you deduce that from my time? Yeah, Kendrick is
We'll
here.
add a couple of
Thank you.
seconds.
I'm giving them a
If you could
chance.
please turn off.
My throat is not
I
doing
forgot
too
that
well.
a very important rule. Can you please turn off your cell phones?
Thank you. Okay.
You will not be penalized.
I appreciate that. Downstate's diagnostic medical imaging program provided me not only with the technical skills required to excel in sonography, but also with the opportunity to pursue further education, culminating in me pursuing a master's degree with communication at Syracuse University. I'm now doubling as both a cardiac sonographer at a top facility and an echocardiography instructor. I'm also now considering medical school, which I would not have had the exposure to the field to consider otherwise. This program isn't just about learning to operate advanced imaging equipment, it's about opening doors for students who might otherwise face insurmountable barriers to success. It's a pathway that has empowered many like me to break cycles of poverty while contributing meaningfully to our community's health. Downstate's DMI program has a low cost, which allows it to be a selective program because everyone wants to go, right? So this means that every class that enters is academically prepared for the vast information required to succeed. Professionals who graduate from Downstate know their stuff, and this is known throughout the field. The name carries weight. As the most affordable ultrasound program in New York City and the only one that provides a bachelor's degree, the potential closure of this program, which may happen, you guys, would be a significant loss. Pardon me, I lost my place. It would deprive future prospective sonographers of the opportunity to receive this education that builds careers but also strengthens our healthcare system. I was even able to intern in both general and OBGYN sonography at Downstate, learn from the best while serving the best patients. I urge you to see this program as an investment in our community's future, where every aspiring student, regardless of background, has the chance to succeed, and a future where patients can be cared for by professionals who look like them. While working on a published article I co-wrote while studying at Downstate, I learned that patients who are cared for by healthcare professionals that look like them often face better outcomes. With all the mention we've heard today about implications for women, especially Black women, as it pertains to pregnancy and birth, it is more imperative than ever that we consider who our sonographers are. We are cardiac, vascular, OBGYN, general, musculoskeletal sonographers, and more, which Downstate teaches all, not everywhere does. Let's not cut off our nose to spite our face by cutting off an important leg of healthcare education provided by Downstate in a way no one else does. Thank you for listening, and thank you for your commitment to the health and prosperity.
Thank you. Thank you. She benefited from from having a cell phone go off in the middle of her presentation, her testimony. So she should thank the person who forgot to turn off their cell phone. But thank you very much. And I hope that maybe if you can send that testimony to us also. Thank you. If you could state your name, please.
Yes. Hello. My name is Soleil. I come to you today as a full spectrum doula, organizer, and public health advocate. I'm repeatedly seeing the plans for a renewed birth center in SUNY Downstate, and that's good. I'm very happy to see this. However, I want it to be completely reimagined. I would like it to be centered on the Black midwifery birthing model, as this is the expert field on birth for Black women. To center Black mothers, Black birth, and infants is to honor Black midwifery. They are the experts. While OB is a necessary tool and set of skills I appreciate, and I appreciate them so much, the Black midwifery birth model should be the anchor form of practice for birth. OB care is specialized care, therefore I love this recommendation and hope for it to be approved. I do not think, though, that it would meet the community's full needs without the center of the Black midwifery birthing model in this new plan for the center, for the birth part, the birthing, the maternal and infant care part. And a side note, I'm happy that Fred Baptiste brought up the decrease in beds, because that was just mind-blowing to me, but I don't think that should happen either. So yeah, that's all I have to say.
Thank you. Before we announce the next individuals to speak, I just wanted to make everyone aware that our state senator, Zelnor Myrie, Anthony Gay is here, Director of Community Affairs. He is here representing his office and just wanted to be recognized. Is he, Anthony, are you here or do I need my? Oh, okay. Hi, Anthony. How are you? Thank you.
Good afternoon, ladies and gentlemen, members of the board. My name is David Gallimore, one of Downstate patients who love Downstate. Let me say this. I'm looking at your proposal that you put on the flyer that's going to get done. But one thing I want to say to you, I would love to see the outpatient area develop and more space, more everything done properly for the outpatient. Because as I said, I've been in and out of, even if I don't have an appointment, I come to Downstate just to see what's going on. Because that's my hospital. I tell my family, I ain't going Connecticut. I ain't going nowhere but Brooklyn. And I'm staying at Downstate. One, they have the best doctors there. So, as I listen to most of those who speak, I want to say, yes, we need a parking garage. Because you have nurses coming in, can't find nowhere to park, to go and take care of the patient. You have patient family who comes, can't find nowhere to park. Let's get them a parking garage. Secondly, there's sometime you go to do different tests, and when you go, there's no space for the patient to get it done, or you have to wait, go down there and sit for hours upon hours. Let's work on that also.
You're going to wrap it.
But as I said, I just want all this you put in place. I'm going to keep my eyes on you guys. I want to see it done so we can move on for a better Downstate.
Okay, well, thank you. And this is an opportunity to make many proposals and recommendations so that, we can that the board will really grapple with to see where, what is feasible and what is the best plan that we can put forth. So we appreciate all the input and we love that the commitment everyone has to SUNY Downstate. So we are looking forward to seeing where we go with all the recommendations. Lukman, okay, I really don't want to embarrass myself. So Lukman is okay. Harris Huberman, Juan Marcos Alakan, Kathleen Salake, Shayla Kamarajan, Montserrat Oni, and Ann Zaldez. Okay.
Good evening, DCAB members. My name is Harris Huberman, and I want to talk about a set of proposals for a lifespan program for neurodisabilities. I'm a developmental pediatrician, and I run the child development clinic at in pediatrics. We see children and adolescents with autism, other neurodisabilities, and a lot of what we do is connect families to services and coordinate care, and we struggle We struggle to find special ed and behavioral and mental health and specialty services, and especially to help families navigate the bureaucratic systems to get those. We try to coordinate with the children's primary care. And when we talk to the providers, like in Suite D, we learn that they're also struggling, that they, in terms of coordinating care and connecting to services, including to ours. So two types of services are particularly important. One is behavioral, applied behavioral analysis, ABA. It's the most proven treatment for autism. It's available through third-party insurance under Obamacare, but it remains really hard to access for families with Medicaid, which is a major health equity issue. The other difficult service for neurodisabilities is mental health. More than 70% of patients with autism also have anxiety, depression, severe psychiatric problems, but good luck finding a psychiatrist who will see patients who carry an autism diagnosis. Then there's the issue of pediatric patients with neurodisabilities falling off the map as they become adults, and there just aren't enough adult primary care or specialists trained and organized to treat these patients. So the idea of the Lifespan program is to integrate pediatric and adult primary care with specialty care, like our developmental ped service, with side-by-side clinics and joint team meetings, to add a family advocate, a community health worker with lived experience to help families with advocacy, with navigating services, to add a behavioral and ABA provider, to the team to build an ABA service that will serve Medicaid patients, to hire a child adolescent psychiatrist, to provide direct services, and also to build linkages with the Neurodevelopmental Research Institute. I'll leave that because Dr. Alat Khan will talk about it. But in other words, to offer integrated care for neurodisabilities that includes peds, family medicine, internal medicine, ensures seamless and youth to adult transition of care. And especially, as we've heard tonight, to connect with our Brooklyn community. If you could indulge me just one more minute, though, I think that all of this is going to cost a lot, but what I basically want to say is that you need a critical mass to get to the point where it's self-sustaining and, in fact, generate revenue. But I think what we need to talk about is not just a stronger downstate, but a smarter downstate.
You know, we can take that as a written testimony.
Actually, I have that. If I could just bear with me just 30 seconds. What I mean by that...
You're going to have a lot of people come after me right now. So let's wrap it up. And, and if you can submit it as a written testimony,
absolutely,
we really appreciate it.
So I think we have smart, dedicated people here. We have administrative staff. We all work in silos, though. Clinical providers aren't aware of what's going on in finance. Admin staff aren't understanding clinical care. There's a lot of revenue that gets left on the table. Things like collaborative care really need a lot of coordination, and we're just not doing it. So I think that we really need a program that puts together. Thank you.
All right. Thank you. Thank you. I just want to emphasize, just to remind everyone, this is being recorded, just in case people came in after I stated. I also need to give a point of clarification that this was Brooklyn for Downstate submitted. This is one of the recommendation. This is not what has been the approved recommendations, but it is one of the considered in the discussion of what we will eventually be some of the recommendations made to the governor's office. So I just need to make this as a point of clarification. This is why we're still having these public hearings and having numerous discussions, and we have a number of proposals or scenarios that have been submitted to the DCAB. So I just wanted to make that point of clarification. Thank you.
Hi, my name is Dr. Jenny Libyan. I'm speaking on behalf of Dr. Juan Marcos Alarcon. Together, we are the principal investigators of a program called REACH, Research and Education in Autism for college and high school students. And one of our elected officials said that we need more programs to teach college and high school students to open up. And this is a pathway to learn about careers in neuroscience and medicine, and to learn more about autism. But We proposed developing a neurodevelopmental research institute at Downstate, which is linked to the proposed lifespan program that Dr. Huberman just mentioned. And its purpose is to connect children, youth, and adults with autism and other neurodisabilities with opportunities to be involved in clinical trials and research. And this program would bring neurodiverse patients together with the pediatric and adult primary care, and the benefits of enrollment in research programs and clinical trials is an important addition. Engagement in research and discovery that directly benefits our communities is a core tenet of Downstate Health Sciences University. And we submitted the plan to you. Thank you for the opportunity to speak.
Thank you.
Good evening. My name is Anne Michelle Valdez. I have been a member of this hospital. I first came to this hospital 42 years ago when I gave birth to my child who required neonatal care. At that time, there was only 2 hospitals that had neonatology. This was one, and Brooklyn Hospital was the other. I live all the way in Coney Island. So you know that that was hard on me. And when my baby came here, I can't be more happy with the services my son received. And then I became pretty much a lifelong resident here. I mean, not resident. I lived not too far from here at the time, back and forth. And I'm back in Coney Island now, and I traveled all this way to speak upon just how important SUNY Downstate is in the entire Brooklyn, and I'm sure further away as well. As they said, this is the only state-run medical school, and that is important. During the time of COVID, I could have went to a lot of different places, but my doctor is here. I am a patient of Dr. Garnier, and he is my life. The minute I have a problem, he's on top of it. I suffered certain things during COVID. All of a sudden, I wound up with Bell's palsy. Couldn't understand what it was, and he immediately knew what it was. I sat in the hospital, in the emergency room of Coney Island Hospital at the time because I thought I might be having a stroke. I spent 8 hours in the hospital there, and they couldn't figure out what was wrong. I came here, and my doctor had all the answers. SUNY Downstate has done so much for me. When I lived in Crown Heights, this is the first place I came. I didn't care if I had to come to the hospital or the outreach clinic. Wherever SUNY Downstate was is where I came. Where I am now, no matter who I speak to, the minute any person tells me I need a doctor because I can't get the help with this, that, and the other thing, I tell them SUNY Downstate. So please, use this money to expand and keep SUNY Downstate going strong. Thank you.
Thank you. Thank you. So this actually concludes the those who registered to give testimonies. I now have a few people who signed up today to give testimony. Hi.
I think I registered.
What's your name?
I registered. Ibrahim, Ayu.
Oh, so I did call you earlier. So, so please, is there anyone else that registered but have not been called? Okay, if you can please come to, the mic. I can give a couple of few before I will have the assembly member, if you want to say a few words now, right after this group? Okay. So is this the group that says that you registered, but, okay. Because I may have called your name earlier and just want to make sure that we get everyone who registered. So we can start, let's start here. And if you can give your name, and we are 2 minutes, please. Okay. And also, just to remember, we appreciate the testimonies. We also want to make sure you get to what your, this is the question of what your recommendation is for the $750 million to improve SUNY Downstate, your recommendations. Thank you.
Okay. Good evening. My name is Ibrahim Ayu. I'm from Crown Heights. and I stand before you today as an advocate and someone who has personally witnessed the devastating impact of healthcare disparities, especially among an ignored community called the formerly incarcerated. I am here to urge our elected officials and the board to fully fund and protect SUNY Downstate Medical Center as a vital institution that serves the most vulnerable members of our community. SUNY Downstate is more than just a hospital. It is a lifeline for people who have been left behind by the system, myself included, particularly older Black men who are returning home from incarceration with severe, often undiagnosed chronic health conditions. One of the most urgent crises we are facing is the epidemic of prison diabetes, fueled by years, if not decades, of a commissary diet that consisted of mainly ramen noodles, chips, and cream-filled cookies. These are not just snacks. They have been survival food for the people like us who were trapped in a system that provided little access to fresh, nutritious meals or even potable drinking water. By the time many men are released, they are already suffering from advanced diabetes, high blood pressure and hypertension, and other diet-related illnesses, often without any medical guidance or resources to manage them. And SUNY Downstate plays a crucial role in bridging that healthcare gap. When I came home, I was a member of across the street, is my hospital, Kings County, and they work in partnership with the PORT program for people that are returning citizens. So if funding is cut for SUNY, then where will these men go? Who will treat them? Who will even teach them how to eat? Because we have also monthly meetings where we just get together as formerly incarcerated men and talk about our issues in terms of access to housing, which they also help with there, as well as mental health assistance. So this is not just about a hospital budget. I'm the chair of the Justice Reform Committee of the Brooklyn NAACP, and this is a racial justice issue for us. I'm also a member of the Double Love Experience Church, and we are a radical assembly of believers, and I believe that is our faith, and your faith should encourage you to keep a hospital that held the sick open. Thank you.
Okay. So, thank you. Thank you, and we are excited to say that SUNY is not closing. SUNY Downstate Hospital is not closing, but we appreciate what you have brought to the table, and we also want to make sure that you can submit what your recommendations are to improve the hospital. Okay, why don't we're going to go to the next person here, and then we're going to come to you, okay?
Good evening, President Ramsey, Chancellor King, and fellow advisory board members. There is a renewed recognition that Downstate's
excuse me, can you just give me your name, please?
Samuel Marquez, SUNY Downstate.
Thank you.
Give me back my seconds, though, please. There is a renewed recognition that Downstate's educational and healthcare programs are deeply interconnected with Kings County Hospital. Now is the time to revisit the idea of a bridge. A physical bridge linking Kings County Hospital and Downstate would greatly benefit patients in our community. This is not a new idea. With a direct connection, whether a bridge or tunnel, services would be shared more efficiently. Patients wouldn't be needed to be discharged, placed in an ambulance just to cross the street, and then readmitted to another hospital. Currently, some patients discharged from Kings County are transported by ambulance across the river to NYU or Bellevue, placing an unnecessary burden on Brooklyn families. Instead of being able to visit their loved ones close to home, they are forced to travel the extra miles to Manhattan. And on a cold winter night, do they make the trip? This solution makes financial sense as well. A shared infrastructure would place both institutions effectively under one roof, allowing for more efficient physician and professional staff coverage, particularly at night. Most importantly, neither hospital would lose primary compensation for a patient when sharing services, a critical factor driven by billing practices, though the details goes beyond what can be covered in a brief 2-minute discussion. In fact, it's not a discussion because there's no feedback. And I'm just, with all due respect, the collective brain power that's on the stage, I fully respect, so I'm waiting for your insight. Importantly, fewer, if any, jobs would be lost. Each specialized service could develop economies of scale while retaining most of its personnel. A bridge would be a key component of any long-term strategy to address the financial challenges of University Hospital. Thank you very much.
Thank you. Thank you. You can please state your name.
Hi, good evening. I'm Kadeen Waldron, speaking under the name Dana Sieg. So I'm a public health student at Downstate and a Medgar alum, but I'm also a patient at Downstate Hospital, whose quality of life depends on the quality of care she receives. Some of what I'll be saying has already been said, but I think it's worth reiterating. One, in public health, we speak about the social determinants of health, and we talk about health system strengthening. SUNY Downstate is a part of the New York State health system, and it aims to decrease the health inequities caused by the social determinants of health. The early phases of the pandemic indicated strongly what disinvestment and underinvestment look like. Patients dying in hallways, staff dressed in garbage bags to combat infectious disease, and clinical supplies so low that resource rationing saw Black, disabled, fat, elderly, and other vulnerable patient populations deny treatment interventions in the resulting resource scarcity. Similarly, in its own later case of resource rationing, we saw Downstate close a school-based clinic program. We should bring that back, by the way. At the time when we were managing outbreaks of measles, RSV, influenza A, and the potential bird flu epidemic, and while we are still dealing with the COVID-19 pandemic and its child-long COVID, and while we're also seeing an increase in kidney disease, diabetes, cardiovascular disease, and other conditions caused by COVID-19, we need to look at maintaining and even increasing capacity. Let's do the same for NICU beds. Two, increasing imaging capacity and quality of service. As a patient, I have gone to Downstate for x-rays and MRI and other services, and spent hours waiting to be served. In one instance, my appointment began at about 10 a.m., and I reached home that evening after 5 p.m. That was because there was one MRI machine to serve emergency, outpatient, and inpatient services. Time theft is a painful part of service utilization for those of us who are low income and underemployed. Every clinic appointment is a day lost. This will worsen with the potential end of telehealth services. The advisory committee should consider spending funds on a department-by-department assessment, evaluating capacity, patient-to-technician ratios, service reach, follow-up, and retention, and more. And also, let's expand our orthopedic services, because I have also spent a long time trying to get service there.
Thank you. Thank you very much. And please feel free to submit that as a written testimony also. Thank you. If you can state your name, please.
Daisy Vera. Ladies and gentlemen, thank you for the opportunity to speak today. My name is Daisy Vera, and I stand before you as someone who has personally benefited from obtaining a bachelor's degree in diagnostic medical imaging at SUNY Downstate. I wish to emphasize why the program should continue its operations and reopen its applications. The DMI program at Downstate is recognized for its quality education and exceptional reputation within the ultrasound community. Graduates are highly regarded by employers and respected in the field for their expertise. The rigorous training we receive prepare us to perform with precision and skill. This level of education is rare, and it's something we must protect. Graduates are moving on to in-demand careers, earning high wages and contributing to the economy. Sonographers are amongst the highest paid in today's allied health workforce, and their success means higher tax contributions to New York State. By investing in the DMI program, New York is investing in its own future. Graduates not only fill essential roles in healthcare, but also provide a significant economic return through taxes and contributions to local communities. I am a proud example of the program's success. During my time as a student, I became homeless and moved into a shelter, having only my family's love and a powerful education to get me by. And yes, education is powerful. Without the affordability and quality education provided by the program, today I would not be in a position to save up for the purchase of my own home. I would not have the power to change my circumstances that many others are facing today. I cannot imagine a fellow Brooklynite, Cypress Hills in the house, New Yorker, or anyone being deprived of the same opportunity due to a decision to shut it down, the only public KHEC accredited program in New York City. New York needs sonographers, and Brooklyn needs Downstate DMI program. Without trained diagnostic sonographers, hospitals and medical facilities would struggle to deliver timely and accurate diagnosis, potentially jeopardizing patient outcomes. I ask you to consider the long-term benefits that this program provides. SUNY Downstate's diagnostic medical imaging program is an asset that must not be taken for granted. I implore you to keep this vital program open for the future of our community, our healthcare, and New York State. I urge you to consider reopening applications and admit students in time for the upcoming academic year, because
thank you.
education is powerful.
Thank you. At this point, I think you're going to be the last person. Is there any, let me hold, just before we do that, because I just want to make sure. Felix Kindle, Joan Rosenfeld, Phoenix. Oh, no. Okay, I think that's it. Okay, he'll be the last one.
Hello, everyone. My name is Josue Jean-Baptiste. I agreed with a lot of the things that I heard today. I think this first thing that's on the list, discussing decreasing the number of beds, is asking us a question of whether or not we need the hospital to begin with, starting with whatever small number that can be requested to decrease. I don't agree with that first thing at all. At all. It's a situation that may lead to that number of beds gone with people of that amount in the hallways instead of in a room. I just don't think it's right. I agreed with scholarship, I agreed with scholarship being a thing that some of this money can be directed toward, but not at the expense of having doctors, not at the expense of having the equipment that's necessary to ensure that everyone is being cared for to the fullest degree. I also considered a community pool with this money. I think this is something that would keep people from, if people are learning how to swim, just like the pool that I visited here regularly when I was a student, that taught me how to swim. I avoided dying out everywhere else that I've gone to swim because of that. That alone. I think that's something that will keep people going. I'm pre-diabetic. That's something that'll keep people working out. That's something that'll get me working out, keep me healthier than I am now. I think it's something that is historically significant, excuse me, and it's worthwhile. I think, I don't know if Downstate serves as any kind of psychiatric support. I think that's something that if it's not there, should be there. It's in Kings County. I think we need more. We need more psychiatric support. Not the involuntary hospitalization kind, but definitely the kind that offers people to the opportunity to discuss when they're frustrated. Thank you.
Thank you. Thank you. Yes, if you can please state your name.
Yes, my name is Karen Fleming. I believe I was on the list. I didn't hear you call me, but you set the timer off. I didn't start talking yet. I want to thank you all for putting in the considerable time that it takes to do these kind of things. I understand very well, and I also understand you're not compensated. However, at the last meeting, one of your members said to me, we need to trust the process. That's been ringing around in my head ever since. That's a whole month ago. And the reason is because if we go back, what's the expression that says, if you don't remember the past, you're condemned to repeat it? If we go back to 2016, you all may remember Vital Brooklyn. I was one of the people that fought valiantly against closing and against that combination of hospitals and all of that. I was fighting for Kingsbrook mostly because that was my mother's hospital. So this is the second time in my life which I've looked out the back window on my house, and now the state is talking about closing down the hospital. That's my hospital. I'm not really happy about that, and I think the devil, as they always say, is in the details. I believe that you all believe that you're going about it in the right way, that your heart is in the correct place. I believe that. That doesn't mean that the rest of the system is engaged the way you are. So what I want to say is, as I have looked at what the public officers law says, I didn't make this up, come from them, it says it is essential to the maintenance of a democratic society that the public business be performed in an open and public manner. and that the citizens of this state be fully aware of and able to observe the performance of public officials and attend and listen to the deliberations and decisions that go into the making of public policy. You all are making public policy, I think. Okay, the people must be able to remain informed, and they are to retain control over those who are their public servants. That would be you. It is the only climate under which the commonweal, which is such a nice word, will prosper and enable the governmental process to operate for the benefit of those who created it. Okay, so you are meeting at a time that we don't know about. You are discussing, I presume, all the nuts and bolts and the ugly stuff. We need to know what that is, because you are here to serve us. We're not here to serve you. You work for us. And it's our money, my money, their money, everybody's money, that you are going to decide how we ought to spend. That $750 that she's talking about, that's my money.
Right.
His money.
And
his money.
Thank you. Thank you. Just so, and we appreciate that, you know, everything that you said. You know, one of in the statute, we are doing the public hearings. And so we do want to make sure that that is on the table. We are required to do 3, and we are going to do 3. We are also have a very, you know, ambitious deadline to make these recommendations.
I'm talking about the ones that they're not.
Right. I would not do that, but thank you. We also, just to make sure that this public hearing will be on the public website, which is downstateadvisoryboard.org. And we are, yes, so I just want to make sure that hopefully in the next couple of days, it will be uploaded on that site. But thank you. Yes, if you can state your name.
Everyone. My name is Dr. Maureen Beverly. I'm founder of Maureen Beverly MDP LLC, Patient Engagement and Cultural Competence, and I'm also on the committee for Downstate Health Equity Coalition. I think it's important that Downstate mission should be that they're the top hospital that improves the health of the Black population across the nation, and everybody else should take, you know, adherence to how it's done. And I think one of the things I focus on is patients. And I was at Kings County, and I was in charge of the congestive heart failure readmission prevention program. And I just want to give you a story and recognize that the elderly Black population is not included in the cultural competence conversation. When a patient said, my parents were a step away from slavery and my grandparents were slaves, who understands that? Or I picked cotton in the South and I paid my dues, I don't deserve to be treated like that. The other thing I want to also bring to the attention for health disparity, to move from health disparities to sustainable health equity, negativity in the medical records that nobody talks about. Everybody heard the word non-compliant, right? Have you ever heard the why question? So we don't ask why, but we write it non-compliant in the medical records, written 2 or 3 times. That patient is under the health bus, and it's more directed towards Black patients. A simple example, 60-year-old African-American male recently diagnosed with congestive heart failure, returns 2 weeks later, heart failure decompensated due to non-compliance. When that patient goes up to the unit, anybody's gonna care about him? And the team at Kings County, they said, Dr. B, ask why, because she's gonna bug out. And we asked the patient, why can't you take the medication? I can't take the water pill. Why can't you take the water pill? Because I drive the number 7 train. And you know, the water pill makes you pee a lot. And so I think systems can change. The same cardiologist who ignored him said, take the water pill when you go home. Be aware that by the time you get to your shift, you have less of a reason to urinate. But to the degree that you do, we're gonna give you a cubicle to use in a private space. And the patient said, if I knew I had to choose between peeing and breathing, I would have chosen breathing. So we have to be cognizant of that and to recognize, give me 2 seconds, and to recognize that the patients with sickle cell, once they get to the adult world, they are treated horribly. The drug seekers, they are least addicted and the most vilified. And I just want to share with the committee, it's my book I wrote, 9 Simple Solutions to Achieve Health Equity, a guide for healthcare professionals and patients. And the reason I want to share this because the patients are a part of the solutions.
Right.
And it's the story, and I would like to share it, and if you could read it, whoever I'll give it to, or everybody could buy it on Amazon. It was #1 release.
Thank you. Thank you. And we can take that if you like to share. Thank you. Thank you. Oh, you would like to speak? Okay. You 2 minutes, and then you will be the last person.
Okay.
Oh, I mean, before the assembly member will close us out.
Sorry. Good evening, distinguished panel. And I'm sitting here, I'm saying, hey, it's an opportunity to speak. And this year's caucus word was bold. So I have to be bold.
Absolutely.
My name is Alethea Aline. I live in this community, and I'm thinking to myself, I'm getting old. So I've moved into that area in 1975. That means 50 years. I've been living 2 blocks from Downstate. And as a little girl, 8 years old, I remember us driving through the neighborhood, and I looked at the place that they're building this school, and I said, I'm going to be a doctor. I'm going to go to school right there. I had my whole plan. And that never happened. I went to many different places, but I ended up at Downstate anyway. Something in my heart, right? I worked at the Brooklyn Children's Museum, and while I was at the Children's Museum, I learned that they built the museum down under the ground because they didn't want the neighborhood to know what was there. And I thought, this is disgusting. And then I went to the Brooklyn Museum, and everyone thought it was a prison because it was far from the community, and no one knew what it was. They did a capital plan for that. And so we said, how do we bring the community in? So I have an idea about how this visioning happened to create the Children's Museum as a huge yellow building. They did a national competition to get ideas on how to build something, and they did the same thing at the Brooklyn Museum of Art. Now you go to the Brooklyn Museum of Art, you can go outside, you can play, you can sit, you blah. And that's how I'm used to seeing something happen. Not here's the money, now what can we do with it? I like the visioning first because that's what I'm used to. So I'm going to encourage you to think big. Think big. Big. Think big. We were the tallest building in that neighborhood all my life. We can be the tallest building now. Everything everyone said can be in there. 360 degrees of health. I want a rooftop garden. I want to jog. I want places to run so I can lose some pounds. I want a swimming pool to swim. And we want health care, all kinds for the children. We want pipeline programs. We want it all. And you guys, you have the ability to get it done. Think big, taller.
Thank you. Thank you. Think big, be bold. We were at the...
Miss, were you not going to call us who signed up today?
Pardon me? Assembly member, would you like to say something, or can we, 2 more people? Okay.
My name is Jorge Artalejo, and it may be 100 years since Mr. Everett had been born, but it's time to put the white political football that New York has engaged itself in with SUNY Downstate, that we hear in the stories that are told here, that those individuals who come forward and who have had to endure it through tolerance and resolution, the care that is given to them down here in Brooklyn, where it is that it's 100 years since that time, and yet the facility that is managing the care hasn't come forward more than 5 years. And now we're engaged in conversations that should have taken place sometime just after 25 of 100 years before. And there's questions even in the community that is told outright that the hospital is not going to close, you still have members of that community stepping forward and asking you not to close the facility. Why is it they think that the facility isn't going to be closed when it clearly has been stated here and on numerous other occasions I would believe that it is going to be closed? And that you have a medical school that's attached to the hospital that hasn't grown and expanded to care and hasn't found and hasn't been able to address the differences between 2 genetic groups and factors one against the other. That's completely unacceptable for a state in New York. And we don't hear the congressional representation come out of Washington saying, oh, we're going to give you this so that you can in fact do this. Instead, we hear a complaint about how the process is managed. And we hope that the money is allocated, that it is audited and kept abreast like it's being kept abreast in Washington now.
All right, thank you. Thank you. Can I have one more person? Thank you.
Hi, I'm Dr. Ben Reagan. I recently got a life-saving appendectomy for a burst appendix and stayed at the hospital for a week. Although the doctors and medical staff were great, there needs to be significant basic infrastructural improvements. During my hospitalization, there was no hot water, and I had to clean my body with heated wet wipes. I was not able to shower for a week. On top of that, there is no potable water coming out of the tap, and I saw signs apologizing for the plumbing situation dated from 2019. This meant that if anyone wanted to drink potable water, the hospital had to supply them with small plastic water bottles that run out quickly. Not only does the use of plastic bottles contribute to waste and trash, but they can result in the ingestion of microplastics, which in the future will result in more hospitalizations. I believe that prioritizing improvements of infrastructure facilities is needed to help patients heal faster, reduce the number of times they have to return to the hospital, and give patients basic dignity when they are at the most vulnerable. Thank you.
Thank you. Thank you. We're now going to have Assembly Member Brian Cunningham.
Good evening. How's everyone doing? Okay. So let me just say one, thank you, Dr. Ramsey, for hosting today. Thank you to our moderator and making sure we got through the conversation. Everyone had an appropriate time to speak. To Fred and to UUP and all the members of Downstate, thank you so much for your incredible work. Chancellor, good to see you. Welcome back to Brooklyn. And to the concerned clergy, also, thank you so much for your incredible work with Downstate and helping to keep Downstate alive. To my colleagues, thank you so much for being here. It shows that we are all united in this fight. Let me first begin by saying, as I drove down from Albany earlier, my first meeting today was with medical students from Downstate, and I see two of them over here, and it was really good speaking with you earlier and hearing your concerns about what's happening with Downstate. The one thing I will say to start this conversation, or to end this conversation, rather, is thankfully we are having a conversation not about closing Downstate, but how to make Downstate better and stronger. So let's first celebrate that as a huge win from we were 1 year ago. I want to thank the incredible staff at Downstate for all the incredible work they do. What was clear to me throughout the entire conversation tonight was that we do not have a problem with the medical professionals or with the care given at Downstate. We have a facility issue with the facility of Downstate that has been here for too long and needs necessary improvements. And that's exactly what we are trying to do. The most important voices, and why I waited till the end to speak, was because I think oftentimes we are so used to hearing ourselves speak in Albany and in City Hall and all over the country, listening to ourselves talk about ideas. But the ideas that we represent are really the ideas of people whose districts we live in, work in, and work for. So it was really important for me tonight to listen and to hear all the ideas, and for this board to hear the creative ideas you have on what you see as the future of how we rebuild this facility and make it stronger. My colleagues and I, Senator Myrie, Member Waterman, Latrice Walker, are all committed to making sure that in this budget that we get it right, that we make sure that we get the proper allocation of money, and that we find opportunities for new resources and new funding. We know that building a hospital and maintaining a hospital requires constant funding, and for years we have not invested properly in our hospital. And right now we're at the whims of the federal government. Let's be very clear. Every morning we wake up to a new polarized reality of a new executive order that has given us political whiplash in Washington. We as a state government will continue to be a bulwark against this federal administration and to make sure that we provide the resources in our $238 billion budget to ensure that Downstate has both operational funding as well as capital funding. We are in the middle of the budget fight right now. March is going to be a very busy month for a lot of members in Albany. We're going to be away for 4 days of the week. You won't see us as much back home, but know that we are doing the important work of fighting to make sure the money reaches the right places, and that right place is SUNY Downstate. This fight is a collective fight. It is a fight that is not just with elected officials and clergies and union members, but it is with community members who care deeply, not just about what the institution represented before, but what it continues to represent moving forward. I have a 15-month-old son, and we live on Linden Boulevard, and Downstate is the closest hospital. So for me, access to care is important as a parent. Access to care is important as a parent. So we will make sure we fight for this institution and make sure it gets the resources, and working with our federal partners as well. Because it's one thing, again, to build the state-of-the-art hospital, which we will, but it's making sure we have the medical reimbursement rates from the federal government to sustain that hospital as well. So let's not just fight for the facility, but let's fight for sustainability. Thank you so much for your fight, your advocacy, and I will stand 10 toes down with you every day.
Thank you, Assembly Member. Well, this concludes our If I do one last one, we're going. All right, this is the last one. Also, before Dr. Ramsey leaves, I just want to say thank you. Thank you for allowing us to be here at Medgar Evers. Your staff, your team were fantastic. They were so accommodating and supportive, so we would like to thank you for allowing us to be here at this wonderful institution. Thank you so much. You will be the last.
Yes, absolutely last.
You have 2 minutes, the last.
Keep it within 2 minutes.
No.
Yes.
This is the last.
Yes. Okay.
Okay, one, I just got an announcement that the shuttle is leaving at 9 o'clock to the last 2 minutes.
Yes.
That is it. Okay?
Thank you for your consideration.
If you can please give your name.
Yes. My name is David Alexis. I'm with the Commission for the Public Health System. I'm just here to note that adding my voice to a lot of the conversations that already were made, but the importance of keeping the beds and actually looking to expand the amount of beds I think are really important. In the last 3 weeks, there was 2 hospitalizations from within my family. Both my wife had a sickle cell crisis. There was a flu that had come around and there was a extra usage of beds in the area, so she literally barely was able to get into Kings County because Downstate and Brookdale were full. Because she was this close to her blood pressure was so elevated, had they had to go down to Brooklyn Hospital or Manhattan, she would have passed. So thank the Lord that she was actually able to get squeezed in at Kings County. And then my father-in-law, who had received his kidney transplant at Downstate, experienced complications and had to be hospitalized again, and was able to be stabilized and able to get home as a result of the care that he was able to receive at Downstate. So one of the things I think is really important to reemphasize is the fact that in an underserved community like this, there are so many complex chronic conditions that are here, and it's incredibly important to make sure that expansive services, both inpatient, outpatient, as had already been mentioned, is able to take care of these services. It's incredibly critical. And I think that when we talk about this investment of $750 million, we need to also include infusion centers for outpatient care regarding dialysis, cancer, sickle cell. Many of the clinics, both at Brookdale and Kings County, are full, and oftentimes it can take weeks to get care. Sometimes you have to book, and it's a mess. And this is something that really is important if we're talking about equity of access and care. So I also like to add the fact that when we talk about this as a safety net hospital, and as was already mentioned with a lot of the divestment that's coming, this is an incredibly important thing that we need to get done in addition to community outreach to meet the needs of the community that has already lost a lot of their faith in the healthcare system. Thank you.
Thank you. Okay. Thank you. And I just want to make sure we focus that the question what would your recommendation be? If you can make sure that that's, maybe start with that.
Good evening, definitely. That's why I'm here.
Okay.
Everyone,
Can you give your name? Thank
yes.
you.
My name is Ray Owens.
Ray.
I'm the Deputy Associate Director of Physical Plant Operations and Maintenance for SUNY Downstate Hospital.
Okay.
Yes, the infrastructure needs some immediate attention, but most importantly is recruiting. SUNY Downstate pays less than 50% of what the wages are for the city of New York for the same exact job titles. Plumbers at Downstate make $50,000 a year. Plumbers for the city of New York make about $130,000 per year. The hardest, our maintenance staff, we have less than 50% of the staff required to effectively respond to maintenance issues, take care of the infrastructure, and keep this campus running. One of the hardest things for me is trying to sell Downstate as a place for a tradesman that looks like me, a young man, black, brown, white, whatever color you are, where you can come there and get your career started. Come there and make a difference. Come there and go to school, do whatever you need to do. But we do not pay competitively. Downstate, for the maintenance department and engineering, is used as a throughway. We are qualified. We don't focus on retention. I would like for some of this $750 million to be invested in retention, and some of this money to also be invested in offering competitive wages for the engineering and maintenance department workers of SUNY Downstate. So we can recruit competent, skilled employees so we can maintain the facility as it should be. As a healthcare facility, it has the most stringent codes that are out here in the nation for indoor air quality and patient care. We struggle to make that mark. So please focus on that. Thank you.
Thank you. Thank you. Okay. So this concludes our second public hearing. I want to thank everyone for coming out, but before you leave, I know everybody's ready to go. I just want to say this. I want to thank our elected officials who came out this evening to give their testimonies and also address all of you. Let's give a hand to our Downstate board who have been working very hard. We have Dr. George, Dr. Kennesaw, Chancellor King, Dr. Cowell, Dr. McDonald via Zoom, Dr. Moore, Andrew Rhyme, Pastor Straker, and Claire Patterson. We want to thank you for coming out and being here with us this evening. Please, there is a third public hearing on March 13th. And you can register. We will have flyers and begin registration probably early next week. If you would like to submit a written testimony, please do that also. And